and that is paying people to stay home and not work and limiting them reopening the economy. So he's just reopened the door, so I'm going to stop talking.
There he is. So I'll cut you off there and we'll head over to Rideau Cottage. Let's take a listen in live to the Prime Minister.
Recognizing that today marks the 75th anniversary of the Battle of the Atlantic. As we remember the sailors, soldiers, and pilots who helped turn the tide of the Second World War, we honor all our veterans who stepped forward so we may live in peace. We think of the brave men and women who serve today, and we mourn the 6 heroes we lost just last week. To their loved ones, to those serving on HMCS Fredericton, and to all CAF members, I want to once again offer my deepest condolences to Canadians. Over the last 4 months, Canada has faced challenge and heartbreak on a scale we could never have expected. So if you're feeling overwhelmed, that's understandable. If you need support, that's okay. In April, we launched Wellness Together Canada, a website where you can find people to talk to if you're in crisis. And today, we're taking another step forward. Our government is investing over $240 million to bring healthcare online. We're expanding existing online tools, creating new virtual platforms for mental health and for primary care. Let me start with a new platform for mental health. Whether you're looking for strategies to manage stress or support from a professional, this will be a resource for you. And if you're part of a marginalized community and you need specialized tools, well, there'll be specific help for you as well. If we can provide mental health support online, there's no reason we can't leverage technology in other areas of healthcare too. This $240 million investment will also include funding for virtual care for times when you don't need to see a doctor in person. Just take video conferencing. By helping doctors run appointments online, you can stay safe at home while getting care, and our hospitals can stay focused on those who need it most. If we can use apps to order dinner and video chats to stay in touch with family, we can use new technology to keep each other healthy. Today,
we are announcing an investment of $240 million in online care. This investment will enable us to broaden access to services and provide more resources to Canadians. These funds will be used to create an online platform that will provide a whole range of services related to mental health. It is also money that will make it possible to provide a broader range of virtual care for times when you don't need to see a doctor in person. By providing online care, we will be reaching more people and reducing the pressure on our healthcare system. And since we are all practicing physical distancing these days, this is the right time to invest in these solutions.
To beat COVID-19, we have to think outside the box. When Canadian researchers have a solid lead, we need to make sure they can follow it up. That's exactly what we've been doing over the last 2 months, and we're starting to see real results. Today, I can announce that we're investing over $175 million to support the Canadian company AbCellera for their very promising COVID-19 research. They've identified antibodies that could be used in drugs to treat this virus. This new funding will help them continue their vital work and will support human trials beginning as early as July. But until we have effective treatments, or better yet, a vaccine, we still need a reliable supply of everything from masks to ventilators. So later today, Minister Anand will announce the details of a new COVID-19 Supply Council. This council will be tasked with finding innovative solutions to ensure our country continues to have the vital supplies necessary to keep Canadians safe.
We will be investing more than $175 million to support research that is very promising, being carried out by AbCellera, a Canadian company. That company is currently trying to identify antibodies that could be used in the production of medicines to treat the virus. Our investment will allow the company to continue that research and at the same time will support clinical trials that could be begin as early as July. Later today, Minister Anand will provide additional details regarding the new COVID-19 Supply Council. This council will have as its mandate to find innovative solutions to ensure that we always have the supplies we need, such as masks and hand disinfectant.
I want to end today, as I do most Sundays, talking to families, to parents. I know this is a tough time right now to be raising kids. Right now, you should be able to focus on keeping your family safe, not about worrying about the bills. So this May, you'll get more help through the Canada Child Benefit. When you receive this month's payment, you'll see an extra $300 per child. For families with 2 kids, that means an extra $600. For 3 kids, an extra $900, and so on. This is money for whatever you need, whether it's online tutoring or groceries. And to all the kids out there, I know things are hard for you too. I know you miss your friends, and it's not always easy to do your schoolwork online. But this isn't going to last forever. So keep planning fun things to do with your friends once this is over. Keep up on your homework. And remember, we're going to get through this together. So thanks for all your help around the house, with your parents, and on sticking together through this difficult time. Si vous êtes un parent,
if you're a parent, we are going to be putting more money in your pockets this month. You will see when your Canada Child Benefit comes in a couple of weeks that you will be receiving an additional $300 per child. That means $600 more for 2 children, $900 more for 3 children, and so on, to meet your needs, whether it is for online work or groceries. It's hard these days for families, so we are helping parents to make things easier for them. But I know it's also very hard for children. You miss your friends and you want to be outside or go to the park. I know that you're anxious to see all of this end. The good news is that we have come a long way in recent weeks, but we must continue. I know it will be difficult, but if we all continue to help out around the house and remain positive, we will get through this. If everyone continues to do their part, we will make it. Thank you.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone. Opérateur, c'est à vous.
Thank you. Merci. Première question, Lina Dib, La Presse canadienne. À vous.
Bonjour, Monsieur Trudeau.
Good morning,
J'aimerais
Mr.
d'avoir une
Trudeau.
précision sur les
First of all, I'd
240
like
millions de
a
dollars.
clarification about the
Étant donné que c'est les soins
$240
de
million,
santé, est-ce que c'est de
since
l'argent
it's
que
about
vous
healthcare.
transférez aux provinces?
Will you be transferring
C'est
that
ma
money to
question
the
de départ,
provinces?
et on a entendu
And
Mike Pompeo ce
also,
matin parler
we
de preuves immenses
heard
que le virus vient d'un laboratoire de la ville de
talking,
Wuhan.
we
Je
heard
voudrais savoir si
about
vous avez vu
evidence
ces preuves
regarding the
dont le secrétaire
virus.
d'État américain a parlé ce matin.
And the U.S. Secretary mentioned this morning. Well, that money is for online care and mental health services that will be available at various levels, and there will be money for the provinces as well. With respect to how and where this virus began, I know it's interesting to find that out, but our concern is really to ensure that we can help people now. There will continue to be questions asked, and we will continue to look for answers. But right now, our priority in the coming weeks must be to do everything we can to protect Canadians now. So, should I understand that you did not see that evidence that the Americans have been talking about? Well, there are a number of theories out there, and we've heard concerns and hypotheses as to how all of this began. But right now, my priority is how we manage the situation. After, we can ask those questions and try to find out how this happened.
While this is happening, our focus needs to be on what is happening and how we help it. There will be much time in the coming weeks and months for reflecting on how it happened and how we can prevent it in the future. But for now, my focus is on how we make sure Canadians get all the help they can right now.
Thank you. Operator, next question.
Thank you. Merci. Next question, Lee Berthum, The Canadian Press. Line open.
Yes, thank you, Prime Minister. I just wanted you, if we could speak to a different topic for a second. Premier Doug Ford yesterday took aim at your measures around the assault rifle ban, suggesting that the money for buybacks would be better spent on border security and cracking down on smuggling. Could you respond to his comments, please?
We know that there is more to do on strengthening gun control in this country, which is why we're going to be moving forward when Parliament allows it with stronger measures around borders, stronger measures around safe storage, measures around handguns to permit municipalities to ban handguns within their city limits. We know there is more to do, but we also know there is no place in Canada for guns specifically designed to kill the largest number of people in the shortest amount of time. That is why we are moving forward with a ban on military-style assault weapons.
We recognize that there is much more to be done to strengthen gun control, and that's why we will be introducing legislation when Parliament allows us to do that, in order to strengthen border controls and introduce other measures with respect to handguns in particular, and continue a buyback program for assault-type military weapons. At the same time, I can say that we realize and know that there is no place for weapons that were in Canada that were invented to kill as many people as possible in the shortest span of time. Those assault-style weapons have no place here in Canada, and that's why we have banned them.
And yes, sorry. Tomorrow we're going to see a number of provinces, Quebec and Ontario in particular, start reopening their economies. Do you have any thoughts on the measures that have been announced by some of these provinces, especially Quebec, given that we've seen ongoing increases in the number of COVID-19 cases?
We all, provinces, territories, and the federal government, agreed on shared principles that we believe in terms of opening gradually, opening carefully, and remaining extremely vigilant as different regions take different measures to restart the economy while keeping people safe. Our focus every step of the way is going to be to support Canadians across the country as we move through these next steps. Different regions will have different measures to bring in at different times, and our job is to make sure we're supporting them as best we can as we go through this carefully and step by step. Okay. The
various provinces will be taking different kinds of action. We all agreed on basic principles and the conditions that have to be present for a gradual reopening of society. And our role as a federal government is to support the provinces in the decisions that they make and to be there to help all Canadians right across this country as the various regions begin to reopen based on their perspective and what they believe to be appropriate.
Merci. Opérateur, prochaine question.
Thank you. Merci. Prochaine question, Joël Denis Ballavance, La Presse. À vous.
Good morning, Mr. Trudeau. Now, with respect to the introduction of the virus in North America, there are some sources that are saying that we were misled. Now, is it the 1st of August that you have mentioned? We have always been very clear with dairy producers right across this country, and we will try to bring this into effect as soon as possible, but we did not believe that we could convince the Americans to wait until August 1st. So that will happen on July 1st instead. But as I've always said, there will be compensation for dairy producers. It is a very good agreement for all Canadians, but we also understand that this is an agreement that will have to result in compensation for dairy producers. Yes. If the National Hockey League starts up again, will European players be allowed to cross the border even though they're not Canadian citizens or permanent residents? Well, I believe that is something we will have to look at. Now, whoever is coming in from another country will have to follow all the quarantine rules, but we are not at that point yet in our discussions with the NHL. We realize that it is a possibility, but it will depend on many different factors, and I cannot say more at this point as to what will happen until those discussions have been completed.
Thank you. Merci. Next question, Justin Ling, freelance. Line open.
Good morning, Prime Minister. I want to follow up on Nita's question about this intelligence assessment. The Fox News is reporting that American intelligence is saying there's now a growing consensus amongst major intelligence partners that COVID-19 was actually leaked from the Wuhan government lab. Is that not your position? I mean, if the American government is saying there's a consensus, is it not sort of incumbent on you to clarify Canada's position, given we are a member of the Five Eyes Intelligence Partnership?
We have been cooperating and working with our Five Eyes partners from the very beginning on various intelligence that has come out on this and other subjects. We will continue to work with intelligence agencies around the world, not just the Five Eyes, but friends and partners as well, and look to find answers to the many questions people are asking. But it is still too early to draw firm conclusions, and indeed, our focus remains on how we are working to protect Canadians, how we are ensuring that Canadians have our entire focus right now and our entire ability to support them through this time.
Follow-up?
So when you say that it's too early to draw firm conclusions, is it fair to infer from that Canada has not come to the conclusion that this was sourced from a Chinese lab? And is there any sort of investigation being ordered either by CSIS or CSE to investigate those claims?
We continue to work very closely with our partners and allies, and indeed independently, on many security issues that are important for Canadians. At this point, we are not drawing any firm conclusions.
Marika Walsh with the Globe and Mail. Prime Minister, can you tell us more about the Supply Council? What specifically will it be focusing on, and how long is its mandate?
From the very beginning, we've made it an absolute priority to procure the necessary personal protective equipment for our frontline workers in this country. We have managed to work with the provinces on sourcing necessary products from around the world so that we've been able to meet the demand across the country. At the same time, we recognize that it was important to develop our own domestic capacity for PPE, and that is coming online now. At the same time, we recognize that as the economy starts to open in different places in different ways, it is going to be important to have even more personal protective equipment for people working in the private sector in various industries, and that's why we need to do everything we can to ensure we're getting the right procurement. That's why we're moving forward with this Supply Council, and Minister Anand will be at the noon press conference to answer more questions on the Council.
And on the reopening and how PPE interplays with that, should Canadians expect to be required to wear masks more frequently as this reopens? We've already seen on airplanes that masks are now required. Where else will we see that happen?
I think what specific rules will be in place will depend on the jurisdiction and the region in which people find themselves. We see very different realities right across the country. But certainly social distancing rules will continue to apply, and using masks in situations where it's more difficult to use full social distancing is going to be very important as well. And I'm certain we will be seeing more people using masks. Okay. The
various rules that will be seen across the country will be put in place by local authorities, but there's no doubt that as we move forward, and we have to continue physical distancing in situations where it may be more difficult to do that, such as on an airplane, well, clearly we will be seeing more and more people wearing masks.
Minister Janet Silver, Global News. Will your government be putting forth any sort of fiscal update this month in terms of new government spending related to COVID-19, and would that include plans to start reducing the deficit?
We're going to continue to stay transparent on the investments we're making to help Canadians through this. We knew from the very beginning that one of the best ways to keep people safe and healthy was to give them the capacity to socially distance, to stay home, to isolate. And that meant sending income supports through the Canada Emergency Response Benefit, through the wage subsidy, through loans for small businesses, through many other measures of support for different groups. We know that the best way to stay healthy is to support Canadians while we go through this difficult time. We have been open and transparent about that every step of the way, and we're going to continue to be open and transparent with Canadians about the investments we're making to keep us safe and the investments we'll be making to get our economy going. Our economy was strong before we went into this, and we have tremendous confidence in Canadians' ability to come roaring back as we reopen in a gradual way. And that's why we are confident about the future of the Canadian economy, and we will have, of course, more updates and more to say about that as time moves on.
And with regards to gun control, the grandfather clause of these measures seem to allow owners of these guns to apply to keep them in some sort of fashion. And I'm wondering, is it really a ban if some people can still keep those guns?
We know that banning military-style assault weapons was an important step in keeping Canadians safe. That is something that we have done because guns designed to kill the largest amount of people in the smallest amount of time have no place in Canada. We've brought in a 2-year amnesty so that people who've purchased those guns legally will have time to be able to comply with the regulations the regulations we've brought in, and the buyback program and legislation that we're going to move forward with at the first opportunity when the House turns its attention to things other than COVID. That means that we are going to keep moving forward on reducing the number of assault weapons in this country. The details on the buyback program, the details on the rules as to what happens at the end of this amnesty period will be worked out in legislation with other parties, with the stakeholders across the country. We're going to take this very, very seriously because we, as Canadians know, are deeply committed to keeping people safe and strengthening gun control in this country.
Prime Minister Rachel Haynes from CTV National News. Following up on the gun question, the day that you announced the gun ban during your election campaign, you first toured around the Danforth where a shooting had happened by a handgun. We know that almost 60% of all firearm-related deaths in Canada use a handgun. You keep saying that there's no place for military-style weapons in Canada, but why is there still a place for handguns in Canada? And what evidence is there that shows that banning the guns that you chose will actually curb gun violence here?
We've seen far too many mass shootings in which military-style assault weapons were used to kill innocent Canadians. In Sainte-Foy, recently in Nova Scotia, back at École Polytechnique 30 years ago. We've seen far too many cases in which these guns have caused devastation to families and communities, and that's why it was time to ban them. This is something that we were able to do through regulation, so it didn't require legislation, but new measures that we intend to bring in on allowing cities the ability to restrict handgun use and handgun ownership are going to be brought in as we work on legislation, as the House turns itself to measures other than COVID-19, and we know there is going to be broad support across political parties to do just that. Okay. Nous avons pris des mesures concrètes.
We took concrete action now to limit access to assault-style weapons because there have been far too many massacres and too many innocent victims have lost their lives because of the use of those weapons in the last 30 years. It was high time to take action on this, but there's more to be done. And that's why giving cities and municipalities the ability to ban handguns in the months to come will be important, and we'll be working on legislation to do that with political parties that agree with us and all the various groups that are anxious to see more gun control in this country.
CBC News. I'm hoping you can tell us about the Spartan Cube test setback. There are provinces, including Quebec, that have purchased these. They're set to reopen starting tomorrow. What concerns do you have, or what does this mean moving forward if there are provinces that are relying on this to ramp up their testing to reopen?
We have said from the very beginning that in this unprecedented crisis, we needed to move very, very quickly. We moved quickly on economic measures, but we've also accelerated the testing, the approval, the processes by which we can get potentially life-saving measures out there to Canadians. But when we do that quickly, there are going to be new facts that come in and situations that evolve that will require shifts in our postures. That is why we're being as nimble as we possibly can to respond to what's working, to what perhaps isn't working as well as we had hoped it would. And we will always need to adjust every step of the way as new information comes in on a daily basis through this pandemic, through this crisis. Similarly, provinces will have to adjust to new realities and adjust to successes and challenges as they come up. We know that one of the things that Canadians expect us to do is react quickly as new information comes in and new understanding gets gleaned, and that's exactly what we'll do. On a su dès le début qu'il fallait qu'on agisse rapidement dans cette urgence
We knew right from the beginning that we had to take quick action in this emergency and this crisis to ensure that we were doing everything we could to protect Canadians. And that's exactly what we did by investing and looking at new ways of saving lives. But when you move quickly, you also soon realize that there can be varying levels of success and some challenges that arise with certain processes or products. So we continue to respond, and I think that's what Canadians expect. And in the provinces, people will have to look at that new information and decide whether that will change their approach or their posture. I think Canadians do not expect that everything we say to be perfect for the months to come. They expect us to adjust things when the need arises. Radio-Canada, a concrete question for you once again. Do we have enough test kits now, particularly with what we've just learned about Spartan, to reopen the Quebec economy and Saskatchewan and other provinces? Do we have enough? Those are decisions that regional and provincial governments will have to make for themselves. Our responsibility as a federal government is to be there to support the provinces and territories and find solutions to allow them to do more testing and provide the chemicals or the equipment they need to ensure that their level of testing is appropriate based on what they believe to be necessary. So our role is to support the provinces' decisions, and it's up to the provinces to decide whether this new information means they can go more closely or maybe they should slow it down. But as I say, we are there to help them, to support those decisions.
One of the things we need to understand is it is to the provinces to determine what is the right step for them, given the tools they have, given the profile of the disease that they're facing. Our job as a federal government is to be there to help provide them with the equipment they need, the support they need as they make the right determination in their region, in their territory, in their province. We know that there are very different situations right across the country, and the federal government needs to be there to support the provinces in the different approaches and strategies that they take.
Donc, vous dites pas clairement,
so
oui,
on
a
not
assez de tests pour
clearly
ouvrir
saying,
l'économie.
yes, we have enough tests to reopen the economy. Do you understand that there are some people who are worried, and those people will wonder, you know, if there's a second wave in the coming weeks in British Columbia or elsewhere, can the federal government take control and say, that's enough, we have to shut things down? Is that something you can do? My responsibility is to work with the provinces so that they tell us, well, we need this level of testing. Can and the federal government help us to achieve that level of testing. And yes, our role and responsibility will be to support the provinces to meet those targets. We respond to the requests that come from them and their reality on the ground. Our role is to monitor and coordinate those efforts across the country and ensure that the provinces are able to respond. And if a province starts to reopen and realizes that unfortunately there is an explosion in the number of cases, it will be up to the provinces to respond. And I know that in that province, citizens will say at that point that they want a different approach. But we will be there to support those decisions and make sure they're the right ones for Canadians.
One of the things that we need to know is that as provinces move forward, it is possible that we will see a rise in cases in different areas, and the provinces will have to respond with measures either specific to that area or broader measures. And every step of the way, the federal government will be there to support and be part of the solution as we keep Canadians safe. But I can certainly tell you that after having spent weeks in isolation, many Canadians will be very, very alert to any signs that we might be entering a second wave, and will be demanding that their leaders respond to keep them safe. Merci beaucoup tout le monde.
Merci, c'est ce qui m'a fait la conférence de presse aujourd'hui.
That is Prime Minister Justin Trudeau just outside of Rideau Cottage, addressing a number of questions from reporters. I'll start off with the substance of the announcement that he made, sort of multi-pronged. First of all, $240 million going towards online services for primary health care as well as mental health care. Then $175 million for a company called Abcelera. And my understanding is that is a company that has developed a platform through which, and research basically done around using antibodies from COVID-19 to actually treat the disease. So that's a part of the sort of research package that the federal government has funded and put forth so far. Then the Prime Minister indicated that in about 13 minutes' time, we'll hear from Procurement Minister Anita Anand around the creation of what he calls a National Supply Council to deal with the issue, of course, of reopening economies and having enough personal protective equipment, masks or hand sanitizer to be able to successfully do that. And that's where I want to bring in my colleague, David Cochrane, who, of course, was listening in to the Prime Minister's remarks. A lot of questions for the Prime Minister, David, around reopening the economy, and something we were talking about just prior to his remarks, this problem with this new Spartan test kit, the sort of pause that the approval process has, or the approval of that test has caused. But also he got questions around what does that mean for testing capacity in provinces? What is, for example, in Quebec, if they can't do enough tests, is it safe for them to reopen? Tell us a bit about what he said.
Yeah, it's important to stress that with this setback for the Spartan test cube, which they believe is a solvable problem, it's just not solvable right now. No province is seeing their test capacity go down because of this. They just can't escalate it and expand it at the scale at which they were hoping. And escalated and expanding and broadened testing is a key part, the experts tell us, on being able to safely reopen not just the economy, but reopen society and let people get back to some semblance of what is normal. So without this being able to go broadly into the Canadian testing marketplace, we are left with what we have. So there were a lot of questions there about the various provinces are all taking steps to reopen things like doubling up your bubble, like they're doing in New Brunswick and Newfoundland and Labrador and places like that, or the more aggressive reopenings of economic activity in some provinces. This is going to be a real big experiment for Canada that's going to start tomorrow. We're not going to find out tomorrow. If it works, we'll find out about 10 days to 2 weeks from tomorrow when we see if new testing shows a growth in cases and a surge in positive tests in the economies that are gradually reopening, and whether that means a scaling back of what we're doing economically, or if the test results are good, whether there can be a further broadening of activity after that. But the Prime Minister was asked point blank, if the provinces screw this up, or a province screws this up, can the federal government step in and stop it? I don't think that's something the Prime Minister wants to do. That is akin to the questions earlier in this crisis about using the Emergencies Act, which is something Justin Trudeau and the premiers have made clear they do not want to see happen in this country. And I can't imagine a good outcome if Justin Trudeau were to tell Quebec Premier Legault that he was doing it wrong and had to stop what he's doing in terms of opening up Quebec society and the Quebec economy. That is going to be a challenge for the Quebec government and Quebec society to deal with, the same as it's going to be in Saskatchewan and in Manitoba. The data in places like Saskatchewan and in Quebec, where the transmission rate is still higher than one person infecting one person, R1 is what we call a one-to-one transmission rate. You want it to get down to R0 or R0. Quebec and Saskatchewan are still above the R1 level. So that means that the infection is still on a track to double over a certain period of days. And Montreal in particular is the epicenter for this disease in Canada. So there are significant challenges for the provinces that are taking these steps to reopen where there is still high rates of growth in their population. Less severe in Newfoundland and Labrador, Prince Edward Island, New Brunswick, where there are actually no active cases or no known active cases right now. But this is going to be a significant societal test and a political test as various provinces move ahead with their reopening plans.
I anticipate, David, that Dr. Teresa Tam, who we're scheduled to hear from in about 10 minutes' time, will be asked about this. I'll come back to you in a moment, but I do want to bring in Dr. Peter Lynn on this subject. He's, of course, a CBC News medical contributor and family physician. He's joining us from Toronto. Hi, Dr. Lynn. Good to see you.
Good to see you, Bessie.
So let me start off on this issue with Spartan tests. These are these cube tests that were supposed to work very quickly. Lots of them on order. I think 1 million on order in Ontario, 100,000 on order in Alberta. How big of a blow is this to the testing capacity, the future testing capacity of provinces?
Yeah, so the key was this was portable. It could give you an answer within an hour. So therefore, places that are remote, they don't have access to testing. They don't have to wait for the swabs to get traveled around and sent and then come back 3 days later. You can get the answer within an hour. But if you think about it, each machine will process about one per hour, so 24 per day. So it's not like the thousands and thousands that we're hearing about that are being processed at the big labs. So does it help small communities and perhaps certain emergency situations where you need to know the answer within an hour? Yes. But does it help, does it sort of cripple our system? No, because we still have huge lab capacity in terms of processing the normal swabs that we're doing.
And what about the speed, the sort of issue around approving these kinds of tests? Because we're also going to be in this position when it comes to antibody tests. That's the tests, serological tests that are done to see if you've had the virus. That's currently undergoing an approval process as well with Health Canada. What does it tell us about the speed at which these things are being approved? And should we expect, to be reasonable, a few other sort of hiccups along the way?
Yeah, and I think because of this hiccup, this is a very simple thing. The test itself works perfectly fine. So the cube, it can measure and can find the virus. That's not a problem. The problem comes from the swab, because this test was originally built to look for DNA. Like, let's say, do you have the gene for Alzheimer's disease? That's really what the company was all about. And for that swab, you only need to take a swab on the inside of your mouth, and you just have to get some cells. Once you have some cells, you can do the whole process on it. So what happened was that their swab is for your mouth. Therefore, it cannot fit all the way up into your nose. And you have to actually go pretty high up in the nose. You've seen those long swabs. And so because of that, their swab system is not able to pick up everything. You can only swab the outside of your nose or the inside of your mouth, which now means that could there be false negatives? In other words, we say you don't have the virus, but that's just because the swab didn't get up there. So the device itself is fine. What they have to do is just come up with another swab. Unfortunately, the moment you come up with another swab, you now have to show that that swab can collect samples, and you have to go through the testing again. So we're a little bit set backwards, but definitely it's very fixable. They just have to change the swab. And the reason why the situation happened is because everybody was in a rush to get the testing part right. So the box itself is complicated stuff. So they were getting that right, and everybody forgot that we need to get a good sample. So therefore, fixing the sampling is what they need to do, and then just show that it works, and then they'll get approved again.
Just a quick question, finally, before I let you go, Dr. Lynn, around reopening economies, especially in Quebec, where we're going to see in the next week or so kids start to head back to school. We're still seeing the numbers there, in the triple digits for the number of cases. What is your sense about the readiness of provinces to reopen?
Yeah, I'm hoping that the government is looking at where the numbers are going up. So let's say the numbers were going up in long-term care, let's just say. So then what we could do is start opening up other economies that are not attached to long-term care, or perhaps regions. So for example, Montreal proper, there's a lot of cases there, but outside of Montreal, maybe no cases or very low cases. So what I'm hoping is that they're opening up things in regions that don't have increasing cases. I think that's what they're doing. Number two is that we have to keep monitoring. And number three, we can't give advice like you should be at 50% capacity, because that's not what's going to keep us safe. What's going to keep us safe, which we talked about, is the physical distancing, so that I cannot blow the virus towards you, either by breathing or talking to you or laughing at you. So basically, we need to keep that. And I think what we should be telling people is keep that distance. So individually, we can do that. But we could tell businesses, if you're a restaurant, figure out how everybody could sit 6 feet apart, and your servers can be, 2 or 3 feet apart when they're serving, and so on and so forth. And I know there's going to be lineups and things like that. Let's be like the grocery stores where we can have those markings. So I think those kinds of principles will keep the businesses working well, and it'll keep us safe. So I think we have to just make sure to keep that 6 feet in our mind always present.
Okay, appreciate your insights as always, Dr. Lin. Thanks very much.
Thanks, Fancy.
Dr. Peter Lin coming to us from Toronto, CBC News medical contributor. The Prime Minister also did, as I mentioned, announce $240 million directed towards online services for both primary health care and mental health care. For that, I want to bring in our next guest, Dana Lee Bagley. She's a registered psychologist in Halifax. Hi there, good to see you.
Hi, thanks for having me.
I want to start off with the idea of online services for mental health care right now. So many people having to stay home. How significant or how important is it that they be able to access those services through their computer?
Yeah, so I think one of the good things that came about, and I wish it could have come about in a different way, but one of the good things that came about is an increased focus and attention on mental health and on being deliberate about protecting our mental health. So the physical distancing is absolutely necessary, as we just heard, and it's also really hard on mental health, right? These are not the things that we recommend for good mental health. And so I think it's especially important to be able to access professional services. So these are unprecedented times, and that might also mean that we do things we wouldn't normally do in terms of accessing professional mental health. Mental health translates very well online. You can do therapy quite well. There's studies showing the effectiveness of that. And we also need to make sure that the rural communities have access to the internet, because those are exactly the communities we want to increase accessibility. And often they don't have stable internet to be able to make use of these resources.
That's a really good point. Actually, it's been the point of discussion among parliamentarians and specifically from the opposition parties, too. You run your own practice. What have you seen up close about the effects of this pandemic on Canadians' mental health?
So really, it's pretty much the only thing we talk about in all of the sessions is how to protect our mental health, how to stay stable. We're talking about trying to, again, charge our batteries, do things that are deliberate about protecting our mental health. So it is taking a toll. We've seen some studies showing that it's taking a toll, and also that people are willing to continue doing it if that means keeping people safe. So having additional services that you can access and professional services you can access to help us cope with that is really important.
I just have about a minute left, but my sense prior to this was that access to those services was already strained. It's already an issue for a lot of Canadians. This is more money, but how big of an issue is that access?
So I've seen, people talk about that the first wave is COVID deaths. The second wave is acute deaths like heart disease or heart attacks. The third is chronic disease management, so people that didn't get services. The fourth one is mental health, and it's going to be the longest one. It's the one that we're going to be having to deal with long past when the actually outbreak is done, because there will be long-term consequences, both for the public as well as for essential service workers and frontline providers. And so we're going to need to be mindful of this for a very long time to come.
We sure will be. Thanks very much for sharing your expertise with us today. Really appreciate it. Dana Lee Bagley. She's a registered psychologist in Halifax. We are standing by in about a minute's time to take you back to Parliament Hill for a press conference from Anita Anand and Navdeep Bains, two ministers in charge of procurement. There's the room there that we'll hear from them. We'll also hear from Dr. Theresa Tam, the Chief Public Health Officer. She surely will be asked about some of the questions around a pause in testing capacity or perhaps limits on testing capacities for provinces and what that means for their ability to open things up. Minister Anand will be talking about what is being called a National Supply Council. We know there are issues with the supply of personal protective equipment, hand sanitizer, masks, that kind of thing, or there have been issues. This council is being developed to address all of that going forward and try to ramp up that supply as provincial economies open up. That's it for us here on CBC News. We will continue, though, of course, on CBC News Network. I hope you stay with us and join us there. I'm Vashi Kapelos. Hi there. Welcome back to our coverage of the COVID-19 pandemic. I'm Vashi Capellos coming to you from Ottawa. Thanks for joining us on CBC, CBC News Network, and of course we're streaming right around the world on the CBC News app as well as cbcnews.ca. We are standing by to head to Parliament Hill for a daily update from federal public health officials. Canada's top doctor, Theresa Tam, is set to provide some more details on her statement released yesterday that the COVID-19 curve is flattening. I want to bring back my colleague, David Cochrane, who was listening to the Prime Minister last hour and is standing by with me to take in that press conference from the ministers. Let me start off on the procurement issue, David, because that has been one that has been, with us for the last 6 weeks. Certainly, I don't think I've ever thought as much about personal protective equipment or even known as much about the supply of it. There have been issues with supply. The federal government has ramped up the domestic capacity to meet that supply, certainly. But the idea of what if this happens again, or what kind of personal protective equipment is necessary to reopen our economies, even for the private sector, is certainly one the feds are facing.
Yeah, there's a lot of conversations and questions that are going to come out of this. We'll see what the details are of the Supply Council, but longer term, this has laid very clearly out before the country to see just how deficient Canada is in terms of self-sufficiency on personal protective equipment. Now, that has changed quite dramatically with companies like Canada Goose and Stanfield ramping up to make gowns, Bauer making face shields, and people like Medicom going to build up a domestic N95 mask manufacturing line here in Canada. But we rely on foreign countries to deliver this stuff, and when the world is competing for the same stuff at the same time to deal with the same problem, you have issues on cutthroat competition and then also issues around inferior quality, because some of the things Canada has been able to secure have been found to be not of sufficient enough quality to be used in an acute care medical setting. So we're going to get an update and a path forward, it seems, on the steps towards that domestic self-sufficiency. That's why Minister Anand is there. She's the Minister of Buying. And Navdeep Bains, he's the Minister of Building, essentially, in terms of how this is going. And they're going to give us a sense of what is going to happen there. But it has really shown how vulnerable the health system is and how reliant we are on countries like China, which right now is firmly under the microscope of international and global anger and frustration in a geopolitical sense. Because of what it may or may not have done in the early stages of this outbreak. So that is a challenge going forward and something the country's going to have to deal with.
That's actually what I want to ask you about as we wait for those ministers and Dr. Tam to arrive, because we did see a number of questions directed to the Prime Minister today about a couple of reports coming out of the United States. The first, my understanding is, comes from Secretary of State Mike Pompeo, who did an interview this morning on ABC in which he said, I can tell you that there is a significant amount of evidence that this came from that laboratory in Wuhan. Wuhan is, of course, the epicenter of where this contagion, this pandemic first started in China. He did not, of course, at this point say what the evidence was, but he added the best experts so far seem to think it was man-made. Now, that jumps off another report that talks about China, for example, limiting exports as soon as they recognized it was a contagion in late December, early January. And to your point, David, we are so reliant at this point, as far as the supply chain goes, on being able to get that personal protective equipment, those medical supplies from China. So these questions become even more important for the federal government. And the Prime Minister was asked, well, have you seen that evidence? And he did not directly answer that.
Yeah, he said he hasn't not drawing any firm conclusions on anything about the origins of the virus. The Fox News report, I think there was also a report in the Daily Telegraph, an Australian newspaper, citing a intelligence dossier that had received pointing to this. Without independent confirmation from the Canadian government, without a statement from the Canadian government, I'm not sure what to say about that. A week ago, U.S. intelligence reports were telling us Kim Jong-un was dead. And now South Korea was saying he was fine. And now there are pictures of Kim Jong-un walking around North Korea attending May Day events. So intelligence is not always right. I mean, we have seen a U.S. Secretary of State in the past go to the United Nations and say there were weapons of mass destruction in Iraq, and look what happened there. So there are a lot of questions China is going to have to answer about what it did and didn't do in the early stages of this. It's certainly, there is, whether it came from a lab or came from a market, which seems to be the dominant dominant theory to this point, is something the Prime Minister says will need to be sorted out and investigated after through the initial health crisis here in the country and around the world. But look, Vashi, I don't think there's any question in anybody's mind, on any world leader's mind, that China was not at all candid about the early stages of this and took steps to look after its own interests in a way that may have compromised the interests of everybody else, either in their ability to respond to the spreading of the disease and to ensure that they had the medical supplies and the capacity they needed to deal with the virus once it eventually got to their country. The challenge in all of this is that you still need those supplies because nobody is through this yet, and a lot of those supplies are made in China. And while the United States may have the geopolitical heft to go toe-to-toe with China in a way a middle power like Canada simply just can't in terms of risking the anger of the Chinese regime and losing access to the masks and the gowns and the gloves and the sanitizer that it needs that is made over there.
And that's what's so interesting to watch, kind of the Prime Minister, but as well as many of his ministers who continue to get these kinds of questions as they try to navigate, I guess, the response to that. Because I remember talking to Health Minister Patty Hajdu, who a few days ago, I think it was, maybe the beginning of this week, who wouldn't say, for example, that there should be an investigation at the end of all this into China's behavior. We hear the Prime Minister continually say, those are questions that can be asked, but we're going to do that later. As the U.S., and you're right, there's obviously a disparity in our roles in the world, but as the U.S. continues to talk about this and continues to be more specific about the intelligence or if there is evidence, the evidence that they see, I imagine those questions will persist for the federal government, and it's going to get harder to keep saying, let's just wait until this is all over.
We also have to consider the American context, though, in this, Vashi, that it is in the best interest of the Trump administration in an election year to be talking about blame for the cause rather than blame for the response of the Americans. There's a lot of criticism for the U.S. response and what has happened there in terms of their preparedness and what is happening. And you can see in the protests in their state legislatures and even people going to the homes of state government officials demanding reopening, there is a political desire to talk about other things in the United States right now. And China is one of those things that they want to talk about. Now, that doesn't take away the fact that there needs to be an investigation of some sort to find out these answers, if nothing else, then so that people can prepare better and learn lessons for the next time some sort of novel virus appears and threatens the world's health. But, politics and the pandemic are mixing in a very significant way right now, and we've always got to kind of keep that in mind.
Let me swing back, David, as we wait for the ministers and Chief Public Health Officer Dr. Theresa Tam to what I think a lot of oh, never mind. I think they're on their way out. I was going to say talking about reopening their economies because I think a lot of us are thinking and talking about that. I believe they're stepping up there right now, if I'm not correct. Okay, we're going to swing there and take a listen in to Dr. Theresa Tam as well as Ministers Anand and Bains.
Okay, good afternoon, everyone. So we're going to start by hearing from Dr. Tam and Dr. New, and then we're going to hear from Minister Anand and Minister Bains by video conference. Doctor.
Good afternoon, everyone. Bonjour à toutes et à tous. I'll start with the latest numbers on COVID-19 in Canada. There are now 57,148 confirmed cases, including 3,606 deaths. To date, labs across Canada have tested over 893,000 people for COVID-19, with about 6.5% of these testing positive. Here is the part where we usually move on to a brief update on how we are continuing to slow down the epidemic and what's needed next for us to get down the curve cautiously together. Instead, I want to pause here to reflect on the significance behind our daily numbers that are impossible to fully encapsulate. Each one of the over 57,000 cases has been an illness, striking fear and concern in a person and their family, friends, and community. Each death has been an incalculable tragedy, and to this, that each death has most often meant a goodbye being said with loved ones who are not able to be physically near or to give hugs and comforting touches. It is in these unimaginable tragic conditions that we are most thankful for everyone on the front line of this crisis. Not only do we count on health workers on the front lines to comfort us when we are sick and scared, but they are there too to offer comforting words, human connection, and healing touches. They reach out when we have to remain apart during illness, prolonged hospital stays, and during heart-wrenching last moments. They keep us informed as our loved ones are being cared for, and they share the saddest of news when illness outcomes can bring only tears. Though little can ease the deep pain of loss, there is comfort in knowing how health workers, from those who support and maintain our hospitals and care homes to those who deliver direct patient care, have stepped in and stepped up to allow humanity to shine. From the cleaners who share a quiet word of comfort as they go about their duties, or those who bring by the day's meals, to a whole range of healthcare providers that hold a frightened hand and give reassurance. We can know our loved ones are being provided care with human touch and concern in our stead. As you suffer the loss of a loved one, they weep for you and with you. And all Canadians offer sympathy as you suffer the greatest loss of all during this crisis. Today, I offer these reflections. As I offer these reflections, I'm thanking all Canadians, whether they are helping in our hospitals and long-term care homes, providing essential services, or volunteering in our communities, or continuing to do their very best to stay home to save lives. Because every life matters. So too does our every effort to prevent the spread of COVID-19. Keep it up, Canada. We are stronger together. Thank you.
Thank you, Dr. Tam. We're now going to hear from Dr. New.
Bonjour. Comme d'habitude, je commencerai par faire le point sur le nombre de cas de COVID-19 au Canada. On dénombre actuellement 57 148 cas confirmés de COVID-19, dont 3 606 décès. À ce jour, les laboratoires de partout au pays ont effectué plus de 893 000 analyses et environ 6,5% d'entre elles se sont avérées positives. Habituellement, c'est le moment où nous passons à une brève mise à jour de la manière dont on continue à ralentir l'épidémie et sur ce qu'il faut encore faire ensemble pour aplatir la courbe avec prudence. Mais je voudrais plutôt prendre le temps maintenant de réfléchir à la signification des chiffres quotidiens, des chiffres dont il est impossible de pleinement comprendre le poids. Derrière chacun de ces quelques 57 000 cas se cache une maladie qui a semé la peur et l'inquiétude chez une personne et sa famille, ses amis et sa communauté. Chaque décès a été une tragédie immense. Il est plus triste encore de réaliser que ces personnes sont le plus souvent mortes sans avoir pu être réconfortées physiquement par leurs proches sans recevoir de câlins. C'est en pensant à ces situations tragiques.
This is Dr. Howard New, the Deputy Public Health Officer of this country, following remarks from Dr. Theresa Tam, the Chief Public Health Officer of Canada. Her remarks focused on providing some context to the numbers we've heard so far. We have some some technical issues with our translator, so as soon as Dr. New finishes, we will bring back that audio. As soon as we have that problem fixed, we'll have the translation for you as well. Dr. Tam pointing out that as of today, 893,000 tests have been conducted in this country, with 6.5% of them confirmed positive. That number has ticked up over the past few weeks, the number of positive tests, but that is anticipated as testing capacity increases. She also spoke about the impact for the first time. She says she paused to talk about the impact behind the numbers, and more specifically, the number of people who have contracted this virus as well as passed away from it, the number of people then who have to mourn the loss of their loved ones without being able, for example, to hold a funeral. We've seen so many examples of that over the past 6 weeks. And the translation is back, so we will take a listen in.
Or those who deliver direct patient care. Cleaners who share a quiet word of comfort as they go about their duties. Or those who bring by the day's meals to a whole range of healthcare providers that hold a frightened hand and give reassurance. We can know our loved ones are being provided care with human touch and concern in our stead.
Si vous perdez un être cher, il pleure pour vous et avec vous.
As you suffer the loss of a loved one, they weep for you and with you, and all Canadians offer sympathy as you suffer the greatest loss of all during this crisis. Today, as we offer these reflections, I'm thanking all Canadians, whether they are helping in our hospitals and long-term care homes, providing essential services, or volunteering in our communities, or continuing to do their very best to stay home to save lives. Because every life matters, so too does our every effort to prevent the spread of COVID-19. Keep it up, Canada. We are stronger together. Thank you.
Merci, Dr. New. On va maintenant entendre la ministre Anand.
Thank you. Now we'll be listening to Minister Anand.
Thank you so much, Dr. Tam and Dr. New. I echo your appreciation for our frontline healthcare workers. I, too, will begin by extending my heartfelt condolences to them, to people who have lost loved ones, as well as to the families and friends grieving the loss of the 6 members of the Canadian Armed Forces who lost their lives serving our country. As a fellow Nova Scotian, let me say that we are all grieving with you. Today, I will provide an update on our progress this week.
As in the rest of the world, most of our supplies continue coming from abroad. We are still facing logistical challenges because of the heightened global demand, but significant progress is being made.
Air Canada and Cargojet have helped us bring home 20 plane loads of supplies, with flights coming in nearly every day this past week. We have also engaged UPS to provide additional assistance with moving PPE out of Shanghai. In a competitive environment, our dedicated team on the ground in China ensures that supplies are coming into the warehouse and making their way onto the planes back to Canada. Our objective
is to put safe, reliable, and effective equipment in the hands of our health professionals. And we are taking all necessary measures for this to happen. We are remaining extremely vigilant when it comes to the quality of the products we are distributing.
We make needed adjustments to our supplier base so that we are only dealing with companies that can meet the standards that we require.
Nationally, Canadian companies are continuing to increase production and deliveries are underway.
Thornhill Medical, based in Toronto, delivered their first shipment of ventilators to the federal government. Our first shipments of face shields began to come in this week, with more than 740,000 received to date, half of which were produced here in Canada by companies like Bauer and Toronto Stamp. I am happy to report that we have also signed new contracts for 15.5 million face shields from Sterling Industries, affiliated with Honda, and from HP Canada. As I mentioned last week, we managed to secure a shipment from China of vital chemical components required to produce reagent. This week, I'm happy to announce that we have finalized a new agreement with Luminultra, a leading biotech company in New Brunswick, as the corporation now has the components that it needs to produce enough reagent for 500,000 more tests per week right through to March of next year. Domestic production right here at home.
I am also delighted to announce that we are now signing a long-term agreement with Medicom in Pointe-Claire in Quebec for the manufacture here in Canada of 20 million N95 respirators and 80 million surgical masks per year for the next 10 years, starting this summer. This long-term procurement source for essential products and for other things is part of our plan to ensure that Canada is prepared now and the future in collaboration with Minister Baines. Furthermore, we have signed a new contract with Logistique Unicor, a manufacturing company in Saint-Jean-sur-Richelieu in Quebec. They are providing 11 million medical gowns. Logistique Unicor is one of the 30,000 corporations which responded to the call for action that was published on the buy and sell site, where we are asking suppliers to help us fight COVID-19.
In how companies across Canada have stepped up to meet the current challenges that we are facing together. Their ingenuity and tenacity will help us through this crisis. Last week, we launched a running report of our procurements on our website, which was updated on Friday. Les chiffres démontrent que nous avons fait des progrès.
The figures are showing that we have made progress in ordering and obtaining supplies from the country and abroad. But we will not slow down our efforts
in addition to our immediate
here and abroad. We will not give up. We are not letting up.
Waves of infections or a sudden resurgence at any given time, which would renew an immediate need for further orders of critical supplies. That is why I have formed a COVID-19 Supply Council, which brings together a diverse group of leaders from the Canadian Chamber of Commerce to the Red Cross to provide advice on building innovative and agile supply chains from start to finish. This council is about bringing together diverse industries and experiences in order to best serve Canadians through the next phases of this crisis. The council complements my work with procurement ministers from provinces and territories right across the country. As an example of our collaboration, when we spoke on Friday, my counterpart in Nunavut raised an urgent shortage of swabs. In concert with the Public Health Agency and the Department of National Defense, we were able to ensure that a shipment of swabs was sent on its way to Nunavut within 24 hours. Cooperation has proven to be invaluable time and time again throughout this crisis. Together, we remain vigilant in our efforts to secure the vital supplies that will keep Canadians safe today, tomorrow, and in the months ahead. Thank you so much. Merci beaucoup.
Thank you, Minister. We're now going to hear from the Minister of Innovation, Science and Industry, Natalie Baines.
Thank you very much, Anita, and thank you very much, Carl. Nearly 6 weeks ago, we called on Canada's industrial community to help meet a critical need for personal protective equipment and health supplies. We also reached out to the wealth of Canadian research institutions, universities, and scientists to mobilize science in the fight against COVID-19. Since then, two things have stood out for me. First, the speed at which Canadian companies and researchers all across the country have stepped up and offered their help in whatever way they can to assist their fellow Canadians in the crisis. And secondly, the diverse and ingenious ways that Canadian innovation has been deployed to address the challenges we're facing. Neither is surprising to me, And I'm incredibly proud of the work being done by our world-class industrial and scientific community. Plus de 6,000 entreprises.
More than 6,000 Canadian corporations have offered us their expertise and capacities. We have also mobilized a great number of researchers and scientists who are researching solutions to this unprecedented challenge.
Today, I'm happy to share the most recent progress coming from these efforts. First, I'm pleased to announce a contribution of more than $175 million to AbCellera Biologics. A Vancouver-based biotech company, AbCellera was the first company in North America to receive a sample from a recovered patient. In just a few short weeks, they've screened 6 million cells and have identified over 500 human antibodies. They are now working on identifying which of those 500 antibodies can not only block the COVID-19 virus, but can be made into a drug to treat the virus. AbCellera is currently working with partners to select antibodies that may lead to therapies that are highly potent, broadly neutralizing, and capable of large-scale manufacturing. Antibodies found during AbCellera's research may also be used to create tests for COVID-19, and the company is working with several global organizations to support the development of new diagnostics to monitor the disease. Human clinical trials are expected to begin in the summer. Over the long run, the company will create the first facility in Canada capable of producing necessary amounts of antibodies, so our country is prepared to respond to future pandemics. Let me turn now to some updates on test kits and face shields. We know that we will need a large number of reliable and accessible tests if we are to reopen the economy safely and responsibly. That's why we just signed letters of intent with 3 companies. As mentioned by Minister Anand, Luminultra, Custom Biologics, and Diagnostics Biochem Canada. These companies were selected through an accelerated process that saw over 100 submissions. Similar to what we did with ventilators, the National Research Council of Canada and a panel of external experts identifies the most promising short-term Canadian manufacturing options for testing. La Supergraph Engine.
Engine Supercluster is also supporting other aspects of PPE manufacturing. 8 projects have already been approved.
It has contracted 3 new projects focused on medical face shields. These projects are bringing together manufacturing and 3D printing companies, and the resulting partnerships will result in hundreds of thousands of face shields being produced daily by June 1st.
To conclude, I would like to state that the Scale AI Supercluster is also mobilizing its members and has approved 8 new projects. Artificial intelligence to fight against COVID-19.
Innovation is a central part of our mobilization efforts, and by working with Canadian industry and research experts, we continue in our mission of supporting our healthcare workers and ensuring the safety of Canadians as we navigate this pandemic. Together, we will win this fight. Thank you very much. Merci beaucoup.
Thank you, Minister Baines. We are now ready to take questions. As usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operateur.
Thank you. Merci. Please press star 1 at this time if you have a question. Puis s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de l'inaudible de la presse canadienne. À vous la parole.
Oui, bonjour. I'm sorry, I think maybe you have some technical issues. I can hardly hear clearly the ministers. So I'm hoping that Dr. Tam, you can answer my question. What happened exactly with the Spartan Cube test? How come it was 3 weeks ago good to go and now it's not?
Yes, so I think it was April 11th when Health Canada authorized Spartan, the test kit, under an interim order pathway. So this is part of the acceleration of access to innovative testing. But built into that process is actually clinical validation of the device and its system. So it was actually the National Microbiology Laboratory from the Public Health Agency who collaborated with clinical sites in 3 provinces to actually use this device and system to take samples from actual patients. And so while the Spartan system or the device performed very well in a laboratory setting and along the specifications that the manufacturer had provided, it was in the real life setting, in the clinical setting, where it didn't perform well. And right now, it appears that it may be related to the proprietary swab that goes with the system. So I think what Health Canada is doing is to amend the authorized intended use for research use only, so that more clinical validation can be done once the manufacturer adjusts its system. So I actually think this is a really, it really highlights the importance of the kind of quality assurance that we're putting to our new tests, and that really there's been no use of this test kit in a way that would have impacted patient diagnostic outcomes, because you're doing this in the context of an actual clinical trial evaluation.
Okay, I understand. When you talk about the swab, we're talking about the thing that actually gets the sample, I guess. And if not, please correct me. And my question is, on Friday, you were saying that we were testing about 23,000 a day. You were hoping for almost 3 times as much, 60,000. How does this Spartan Cube setback impact this objective?
It actually doesn't impact it, because the provincial territorial target collectively of the 60,000 is just on the existing PCR tests within the public health laboratories. And then we would add on top of that any point of care testing that comes on board, some of which are already in use, such as the Gene Expert. That is, for example, also being used in Nunavut, for example. So some of the point of care is in addition to that initial provincial territorial capacity target of 60,000. And I do know that, the provinces are ramping up the testing, and we'll see what happens in the next 7 days as they ramp up some more. I know that in the last 24 hours, we actually did over 31,000 tests.
Merci, Dr. Tam. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Lee Berthiaume from the Canadian Press. Please go ahead.
Yes, thank you. This question is for Dr. Tam. A number of provinces are going to take the next steps tomorrow, Ontario and Quebec in particular, towards reopening. What will you and other public health officials be watching for, especially in Quebec, where we saw another 1,000 cases reported yesterday? And does the Spartan recall or the issues that have been highlighted there have any impact on what you're seeing in terms of, or what we might expect in terms of long-term or reopening up?
Well, I think both of these provinces have plans in place to escalate the testing. And as I've just said, that the target of 60,000 doesn't actually include any additional of those new tests like point of care. But this is because we're looking at so many different streams of new tests coming on board. They will have to readjust the timelines of perhaps when they would have expected the Spartan system to be on board. But this is the most prudent course of action, because what you don't want is an actual system out there that isn't picking up the cases as it should. So I think that's actually a really good validation approach. In terms of course, as you've heard from chief medical officers of both of those provinces and across the country, There is no exact right pathway down this slope and into the new realities of living with COVID-19. We all know that it has to be cautious, and we have to actually look at what happens. Some of the criteria that we're looking for is actually published, but it involves, of course, looking at cases coming down. So if you see cases coming back up again, you're going to have to reevaluate what's going on. And of course, one of the critical aspects is your healthcare capacity and your ICU capacity. So making sure that they'll be tracking all of those parameters as they go about these sort of baby steps and cautious path towards this this new reality of living with COVID-19. So I think everyone will be watching very carefully as to what happens to the activities. And I know that provinces are also trying to separate out the actual clusters within certain settings like long-term care from what might be actually community transmission. So they'll be trying to look at the epidemiology from that perspective as well.
Follow up.
The number of new cases that were reported in Quebec yesterday. Do you think it's appropriate for the province to move ahead on its plans to reopen?
Well, I think this is up to, of course, the province of Quebec to look at their particular situation. And I also know that, of course, Quebec is a very big province, and it may not be the same even within the actual province itself. So I'm absolutely certain Dr. Arruda and the Quebec public health system will be monitoring this all over different aspects of the province. And they may not do things at the same time for different areas of Quebec as well. But the details are within the purview of the province.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. La prochaine question est de Philippe Vincent Foisier de Radio-Canada.
Philippe Vincent Foisier, Radio-Canada.
Oui, bonjour. J'aimerais savoir, Monsieur Nou, Madame Tam, est-ce qu'on a assez de tests de dépistage?
Do we have enough screening tests? Because you are talking about a 60,000 target and we are reaching 30,000. Some provinces will be reopening soon, and that is before we are able to carry out enough screenings.
Merci pour la question. C'est Dr. New.
This is Dr. New here. Thank you for your question. It is always a concern for all provinces and territories to have the capacity to screen people within their administrations. The capacity has increased significantly. The provinces and territories are also continuing to increase capacities. As we've said before, there's good capacity throughout the country to take care of diagnostic screening based on the molecular test. Now, we are also introducing other tools like testing at service points. Something is happening now with Spartan, and that's something we need to manage and resolve. But ultimately, we have the capacity, and it's up to the provinces to make adjustments when necessary. And they may also need to loosen up their public service measures. Should I repeat in English? Is that okay?
Okay. What we're saying is, yes, at the present time, certainly the provinces and territories, their capacity for lab testing, which is key, will continue. They've obviously taken steps to increase their lab capacity, and that continues to this day. And certainly within each province and territory, they're making sure that as they maybe start to begins to relax certain public health measures, that capacity to rapidly detect cases is there. Right now, the capacity is based on what we call the molecular tests, and that's something that will continue to be, in a sense, the gold standard for now. But certainly, provinces and territories, as well as the federal government, we're looking at other types of technology to bring more tools available for testing individuals. And we've just talked about what we call point-of-care testing, including the Spartan test, which obviously at this point needs some adjustments. But certainly we hope to, in the coming days and weeks, make the necessary adjustments, at least accompanied, that will allow it to be used in a clinical sense.
Thank you, Dr. Monsieur Foisy. En suivi.
Follow-up question. A clarification. There's something I do not understand. Do we have enough capacity for testing? We are just not doing enough testing? Or don't we have enough? We are doing 30,000 now. The target is 60,000. Maybe I'm not the one who is good in math. Or maybe I'm not the one understanding that enough testing is being done to open the economy, whereas the economy is going to be reopened tomorrow. I will answer, and maybe Dr. Tam will also answer in English. It's difficult because we can't really give you specific figures. It all depends on the demand. If people fall sick, we need to find out if we have diagnostic testing. If somebody falls ill, it's not a matter of just testing everyone. We already know that it's very important to test someone at the right time. If we screen someone who is not ill, there is the danger of having a false negative. So it all depends on demand. What is happening now within the population with the spread of the virus? Well, we have the capacity in the country, but not all provinces and territories. So it's something we need to follow up closely, because if we start relaxing some public health measures, we need a surveillance system and a screening system to properly, rapidly detect the virus. If there is a surge in declared cases, that is really the issue. The issue is not the exact figures or the available tests.
Thank you, Doctor. And I'll turn to the room, starting with Marika Walsh from the Globe and Mail.
Hi, Minister Anand. It's Marika Walsh with the Globe. We're having trouble hearing you, so I'm hoping this will work. I'm just wondering if you can tell me exactly what gap is currently in the supply of PPE that you're hoping this council will fill? What specifically is missing from the complement that this will now help do?
Well, thank you. I hope you can hear me now. Is it any better? The Supply Council isn't meant to fill a particular gap in the supply chain per se, but the goal in establishing the Supply Council is to provide another lens into the point-to-point procurements that we are doing from start to finish, from manufacture to arrival or production in Canada. What is it that we can be doing differently to ensure that we have proper and effective and efficient procurements within our government and across the country? And so the idea is that it is adding to our existing processes by drawing on the expertise of multiple individuals from a diverse set of sectors, so that we can ensure that we are thinking about all the necessary things that we need to be thinking about in procurement. So, for example, in terms of distribution, we have much to learn in terms of diverse communities. Should we be adopting alternative and additional processes to ensure that we can reach vulnerable populations? And part of our conversation with the Supply Council will revolve around Canada's incredible diversity and how we can do better in terms of our procurements to ensure that everyone has the supplies that are necessary across this country.
And what are the government's forecasts of how much PPE we will need, either per number in population or per week or a mix of those, when we reopen? How much more PPE will we need once we are all trying to get back to work?
It's definitely true that across the country, wherever you are, people are talking about personal protective equipment and the incredible needs that we are foreseeing. But let me be clear, our first priority as the federal government at the current time is to procure PPE for our frontline healthcare workers. That is what we are doing every single day, and we are procuring from international sources. And as Minister Baines and I have been working on very hard, domestic retooling is also part of that equation, diversifying supply chains. In terms of what is going to be needed for PPE, this is an ongoing conversation that I've been having with my provincial and territorial counterparts, and that we are going to be continuing to have as we go through the next phases of the pandemic. But I will say that from a procurement perspective, we are planning for the short and the long term. We are planning for this phase as well as potential additional surges in the pandemic so that we can be prepared for all eventualities. This is procurement like it's never been done before for that very reason. We need to be planning for the short and the long term and all eventualities.
Thank you, Minister. Ashley?
I'm hoping you can tell me what the impact of the Spartan testing setback is on provinces and territories that have ordered this kind of test kits. You said they've talked about trying to ramp up quickly their testing. Well, what impact does this have?
So I think this is in addition to the targeted around 60,000. So we still, even within that scope, got another halfway to go. If you think about, we're doing 30,000 a day, say, since yesterday, there's still room for them to continue to ramp up the testing approaches. And so then the point of care, actually, the key adjustments and plans will be for, I think, the rural and remote communities. So the concept of using these more near-patient tests is so that we can render these communities more independent of transportation. So any kind of delays might, in fact, impact on the fact that we need to continue to transport specimens, for example, that would have been dealt with earlier. But we are looking at other supplies of the point of care. So this isn't the only one. So I think it's, again, a dynamic process. There are, suppliers that are a bit more established, if you like. But when we're looking at innovation space, we know that the pathway of innovation will have some bumps. And I think this is one of those bumps. But it only formed one part of the strategy. So I think we will continue to look for other solutions to fill in those gaps. But I think from my perspective, the impact is more on the maybe timeliness of the return on lab testing for the remote.
Okay. And I'm also hoping to get a sense of, how many provinces and territories ordered these Spartan kits, and, how many are we talking about? Thousands of millions of kits being held back because of the setback?
We may have to get back to you on the numbers because I don't actually have them. I just know that it was 3 provinces that helped with the clinical trial, which we were involved in. And I think there were 5,500 test kits as a sort of part of that distribution. Beyond that, I don't know that there was there wouldn't be any distribution, but I don't know how much order there would have been.
I could add something there.
That's great, thank you.
It would be helpful. I think it is important not to refer to what is happening with the Spartan test kits as a recall. This is part of the process of Spartan ramping up to have tests to be utilized. And we were not expecting that they would be ready at this moment in any case. So in my view, the issues that you're highlighting aren't a recall, aren't defective product at all. The Public Health Lab has said that they will be used in research settings, and Spartan will continue to produce and review and revise the technology that it is producing for the rapid test kits. And then as the testing warrants, they will be able to be used across the country. But again, this is part of the process of producing new technology, of producing something that is going to be very important, but is just getting retooled and ramped up at the current time.
Thank you, Minister. Rachel.
Rachel Haynes from CTV. My first question goes to Dr. Tam. The Prime Minister today, when asked about economies reopening, talked about how there's different realities in each province. But we do know that the virus doesn't know any borders, as we've been told many times, and that would apply here in Canada as well. So as the various provinces reopen at different times, are you going to recommend that interprovincial travel remain completely or become completely shut down to make sure that different pockets don't pop up in different areas?
Well, I think we have to continue to share information about what's going on in each jurisdiction, and the interprovincial approach is done by individual provinces, but we know there has to be coordination amongst them. And so absolutely, I think every province will be watching, all the other provinces in terms of where their stance is. For provinces that have very minimal healthcare capacity, they're going to be very careful. Some of the territories are still going to be, of course, looking at the 14-day isolation period for anyone coming inside the territory. And I think some of that will necessarily continue until we've seen what actually happens as people gingerly, cautiously go through the next stage. So absolutely, I think people will be watching the other activities, but the issue of what public health systems might do within the provinces, within their jurisdiction. Of course, from a federal perspective, it's really about maintaining essential services through interprovincial transport in order to maintain the essential supplies that still has to occur. So that will, again, continue as well.
It's Dr. Maybe I'll just add to that is that certainly the provincial authorities and territorial authorities have the best sort of pulse of what's actually happening in their own jurisdictions. They have the data, they know what's happening on the ground. So the issue of travel, et cetera, is not just between provinces, but even within provinces. As we know, even in the province of Quebec, the hotspot is Montreal, and in other parts of the province, the situation might be different. At one point, they even had a restriction in terms of travel within the province. So I think the principle that they're always looking at, including us at the federal level, is about maintaining physical distancing and whatever measures can be brought to bear to try and reinforce that to the point that it's appropriate and necessary within the provincial context. That's what they'll continue to do.
And as a follow-up, as we're talking about businesses reopening and knowing that there needs to be an adequate amount of PPE and masks and other equipment to make sure that we can stop the spread, as part of today's announcement, will equipment be going directly to businesses or directly to healthcare workers where we know that there are still issues in those types of institutions? Will there be some kind of allocation or breakdown of who is getting this PPE?
Well, I think the healthcare system remains a priority. And so that there is an existing mechanism with the province and territories to look at needs and allocation, and that will continue to be very dynamic. And the framework has been worked out. I think one of the most critical aspects of the next stage is to, as the non-urgent health services come back, is for people to actually look at what those requirements are. And I think also, that is done through the provincial system. And also, of course, making sure long-term care, because some of those are private entities, some of them are maybe publicly funded, but that system needs to be able to actually provide the necessary PPE. So those coordination discussions are definitely happening at the ministerial level as well as at the deputy minister's level to make sure that health systems can readjust going forwards. And I think in terms of essential services, there's ongoing discussions, but the key is that any business trying to open must align with public health instructions, and you have to sort of look at the plans for how they reopen and have them looked at by the actual public health authorities. And that's the most important thing, because if you've got the sort of specs, if you like, of the 2 meters or physical barriers or engineering criteria, the businesses know their own businesses or how that works the most. So a lot of them are thinking through exactly how that's going to work in their workplace, in order for them to look forwards to planning to reopen. So there's a lot of work, I know that, in that space. And there's a lot of guidance being developed for the different sectors within the jurisdictions as well. And so that's really quite active right now. And we might get a little bit more of an idea of, well, under which circumstances are people not able to maintain the 2-meter distance? And then that will give us a better idea of what that supply requirement might look like.
Thank you, Doctor. I think we have time for one more question on the phone, operator.
Thank you. The next question is from Savannah Odd from Brunswick News. Please go ahead.
Hi there. My question is for Minister Baines. Today we've seen an investment in virtual mental health care and primary care. I'm wondering what's being done to improve reliable internet access for rural Canadians so that they aren't left out of this investment.
Thank you very much for that question. I'm glad you raised this issue. High-speed internet connectivity is no longer a luxury. It's absolutely essential. And our government recognized that we were dealing with this digital divide. We made significant investments in the Connect to Innovate program, which helped 900 communities receive high-speed internet connectivity. We also unveiled in our last budget a universal broadband initiative worth $1.7 billion. And my colleague, Minister Monsef, is responsible for connectivity in that program, and she'll be working very aggressively to move that agenda forward. Because we realized before, but more importantly in this current context, the importance of internet connectivity for families, for work, for people to get essential information, and this continues to remain a priority for our government.
Follow up?
Yes, so, and for Minister Anand, as we see some provinces move faster towards recovery, or I guess in later stages where they're starting to reopen, I guess, before some others, will PPE distribution be affected by that? So if a province is, I guess, further along into a recovery phase, does that factor into how PPE is distributed? I know it currently is per capita with some wiggle room based on emergency, but could you just elaborate on whether that's part of it?
Kim Bapp, though, to state that the approach that the government is doing is based on requests that have come from the provinces and territories for purchases that they require for frontline healthcare workers. And so, as I said, that is the priority at the current time. In terms of PPE that would be generally available when we move through additional phases of this crisis, again, that is an ongoing discussion, and I've had very positive discussions with the provinces and territories around the procurement table that I have struck with the various ministers from those provinces. But I will say that there is much work to be done on essential services and PPE for essential services. And it's important to remember that the federal government is not the only purchaser of PPE in the country. Hospitals are procuring PPE, individual businesses are procuring PPE, and healthcare centers themselves are procuring PPE. So this is an ongoing conversation, but it's important to remember that there are a number of purchasers in the country. And the most important point to remember is that the global environment is incredibly strained. The demand is high. And so the federal government is taking a very collaborative and cooperative approach with the provinces and territories in trying to determine the best way forward on these important questions.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. Merci.
This is the end of today's press conference. Thank you.
Those are federal ministers Navdeep Bains as well as Anita Anand, alongside Chief Public Health Officer Dr. Theresa Tam and her deputy, Dr. Howard New, talking a lot about testing capacity in this country. Specifically, Dr. Tam says that while we sit at 23,000 tests a day right now, they're hoping to ramp that up to 60,000. I want to bring in my colleague, David Cochran. We just have about a minute and a half, David, to debrief on what was said. But let me get you on Spartan testing, because that's what we've been talking about all day. They did specifically address what kind of impact the capacity impediment right now will have going forward?
Yeah, the Spartan test cube is seen as a bit of a game changer by health officials when it was first announced last month, because it could give you a result within an hour. You could do it portably on site. Worked great in a lab, didn't work great in a clinical setting. The kit itself tests properly. The problem is the swabs don't quite collect the samples to the standard that they want for this to be a reliable part of Canada's testing regime. So it's been sent back for some tweaks and working at Spartan Bioscience, and then go through the approval process again. There's a high degree of confidence that this is a solvable problem and this will come back out. So the downside of this is that it limits their ability to broaden testing in rural and remote places, or to do instant testing at places like assessment centers. But the lab capacity of the country unaffected by this. This is not a drop in testing capacity. It's just a slowdown in the ability to accelerate it and expand it.
I got to cut you off because we're done. Thanks, David. Appreciate all your insights this afternoon. The CBC's David Cochran. That does it for our coverage here. I'm Vashi Kapelos. I'm going to turn things over to Michael Serapio, who will continue our coverage on CBC News Network. Have a great day.
We're being as nimble as we possibly can to respond to what's working, to what perhaps isn't working.
A Canadian developer recalls its new rapid